welcome
hello.
again to the Drake Center. Here we are again, and so excited to be back on this, sharing our journey and our insights. So as I said, I thought today that we would share some questions that we've gotten about our work.
Yeah.
And so there we go.
Yeah. Well, welcome everyone. I'm excited to be back and talking. We've had a couple patients on our last few episodes, and today we decided to take some questions and we put that out there into the community and ask some family and friends, in fact, their general questions about ketamine and our process and really the healing aspects of all of it, of the therapies, of everything, all involved with ketamine, and at least how we do it at the Drake Center. And so one of our first questions I would love to ask Dr. Drake here. And exactly what is ketamine-assisted therapy?
That's a great question.
Because we get that question quite a bit. So,
what exactly is ketamine-assisted therapy?
Is it?
So ketamine is a synthetic derivative of PCP that's used as an anesthetic. It was originally developed at Wayne State in the 50s and has had a multi-decade use as a very safe anesthetic worldwide. When I was an ER doc for 20 years, it was my go-to sedative for kids. It's that safe. Over the last 15 to 20 years or so, there's been a renaissance in investigating the use of psychedelics in their ability to heal and to treat mental illness, treat chronic pain, amongst other things. And ketamine was dusted off, and its psychedelic properties found to be very useful in the treatment of depression. We use ketamine in our process at the Drake Center as part of a guided process of healing that begins with an intake where we get to background information on a patient and find out why they're here, what they're trying to heal, what's going on with them. We then give them preparation to get them ready to get ketamine, describing to them what they can expect in the journey and how best they can use that to support them. Then they come to our office and they have their ketamine treatment in our office. Jacqueline and I are there with them. We have a wonderful supportive space that supports the entire journey and enhances the whole experience. Our patients are never alone. And they receive all the support and guidance that they need during their journeys. After they have their treatment, we follow that up with what's called integration. People have very powerful experiences when under the influence of ketamine, and understanding those can be challenging. So in our integration process, we support people in understanding what did that mean? And how do I begin to make that a part of my life long term? And this supports ongoing healing and transformation for many patients. We find that the ability of psychedelics like ketamine to reach root issues for people and to open doors to transformative healing to be the most powerful work that we've done. Do you agree?
I would 100% agree. Yes, yeah. Absolutely.
And part of that process of that support that we provide is many patients have never had a psychedelic experience before. And so they come to us going, well, what's that going to be like? Or they've heard things about something that might happen, and what's this experience going to be? And they may have some anxiety about it. So how do we deal with patients who have a lot of anxiety about a psychedelic experience and what do we do with that?
And interesting enough, a lot of our patients come to us for anxiety. So by the time they do get to the chair, there might be some nervousness. But we, at our center at least, we know there's a lot to do with set and setting. The other part to it is by the time they get into the actual chair for the treatment, the patient has actually spent a lot of time with us at that point. We've done, like he had said, we do an intake, a pretty thorough intake, medical history, family history, all of that, psych history, of course. And between all that, and then there is the intake and, of course, the prep, patients are usually pretty ready by the time they get into the chair. But, if there's many centering exercises that I do with the patient before we even get to that point anyways. And so they have a lot of tools even by that point. So by the time most of our patients get in the chair, they're pretty ready. And they're pretty excited for the possibilities of healing in this way, because it is pretty interesting. There is something I do want to add, another question that we get a lot. And it's almost the elephant in the room I want to talk about, but is the stigma around it. There is a lot of stigma around ketamine, and obviously with the past in the 70s and 60s of whatever, we get calls all the time of people saying, I'm going to get stuck in the K-hole, what is that? And you have to understand this is done medically, first of all. This is completely a different aspect of that, but there is a lot of stigma around it, and I think you could probably address some of that if you could.
Sure. A lot of people will respond to when you say, you're doing ketamine treatment, and they'll say, wasn't that a drug? Or that's a party drug? And yes and no. Ketamine was originally developed as an anesthetic, but as many medications, it can be used for other things. And there are people who do, in fact, abuse it. And it is a party drug, and that's an important thing to recognize. In addition to that, it has profound benefits for healing and transformation when used within the boundaries of a guided process whose intention is we are using this to open a door into yourself for you to discover things about yourself that'll change you forever. It's not meant to be something that you're using all the time or that you need to support you in life. It's a catalyst for change. It's a profoundly powerful catalyst for change. And when used in that way within those appropriate boundaries, it's safe. It's very safe in the hands of trained and experienced guides who've been there themselves, who've guided many people through this. In our practice, we've treated over 100 patients, well over 600 treatments, and well over 1,000 integration sessions. So we have a profound body of knowledge in this, and that supports that maintaining the intention and the truth of what we're doing. So it's very safe. There's unfortunate that it has that stigma. Mental health in general has that stigma.
It does.
And we're with our patients, we're trying to, one of the first things we do from the beginning is we're so glad you're here and you're doing this and you've made this powerful step, and to begin that process of having mercy on themselves. So yeah, it's very safe. We wish it didn't have that stigma, but we find that that's not what's happening in what we're doing. Right. In addition to our use of ketamine in our clinic, as part of our integration process, we use some other techniques like creative work and virtual reality. And so what are we using? Tell us about virtual reality. How do you use that in the ketamine treatment?
We use virtual reality, and some of you may know it's the headset that we put on. Oculus actually makes one now. There's other devices out there but it's really about the immersive qualities of the VR and why we use it. It has a way of being able to get somebody really present in the moment. And I find that when we put this the other thing too is some of these apps now that we can use with it, you can curate, right? So you can curate to whatever the patient needs. So a lot of these apps are all for mental health. A lot of them are meant to meditation and mindfulness apps. When I say apps, they're actually programs. But when you actually put someone inside of a meditation, that is a different thing than me guiding them. So there's some days that I may, do the meditation and set the intention with the patient before they have their experience. Or there are some days I actually put them inside of a meditation. And that has a world of difference on just everything. It becomes an incredible experience even before they have their experience. Now, do they have the VR headset on while they get the ketamine? No, that is not how we use it at all. I also use a lot of the virtual reality headsets for creativity, and also for lifestyle. For it's an incredible device itself. Like I don't really care who owns it and whatever, but it's the technology of it. There's a lot of connection for me with patients in it. We also can create virtually in virtual spaces together, and being able to recreate some of the things that patients experience in the ketamine experience, being able to, let's say, dance and play in it is a whole different experience versus just painting it on the canvas. Oh, we do that too. And we also do a lot of other mantra type things to really, really embed in their own mindsets really what they experience, and to use these tools, to use the insights that they get in these. And so we take all these different modalities of healing and tools and technology and even mindfulness and meditation practices, because being able to bring somebody present into their mindset is, to me, the most incredible thing. And ketamine has a way to do that as well. It really makes things kind of make sense of you're present and really what's real in this moment. And as much as there's some stigma even around VR even, right? So the stigma around VR is that it's an escapist and all this other things, right? And that is exactly the opposite of really what the technology of it can do, and it's just getting better and better every day. I happen to do a lot of work with it, and have had my own success, as you know, working out with it. There was a point in my life where I decided I needed to use the technology for my own wellness, mental wellness, and it turned into a lot of physical wellness along that as well. But yeah, it's incredible for creativity and mindset, using different things. So, and I have some more questions for you that we have here. One question we do get a lot is, a lot of our patients come to us, are being referred to us, and they may have other medications they're on. And how does that interact? And do they have to have referrals for this? Is it a patient doctor referral, or and how does that work with their other medications?
Sure. So. In general, you don't need a referral to come see us. We take anyone as part of our intake process. We do a thorough evaluation to make sure that it's appropriate for you. And part of that intake process is covering your medications. There are some medications that are incompatible with ketamine, and we would go over that within the intake process and discuss, can you hold that medication? Is it possible for you to go off of that medication for a short period of time, or we might have you hold it for a day, or wean off of it in advance of that. But those are things that we manage. Manage medications, side effects during the treatment, and all of that support that patients need for all the aspects of their treatment, from their medical background to their mental support and spiritual and emotional support. So that's we cover all of that in the intake and the prep, and are able to support our patients through that process. Another question we get a lot is, I've studied mindfulness and meditation, and you guys do mindfulness and meditation in your clinic, but that's never really worked for me. So I don't think that's going to work for me. So what's different about your meditation and mindfulness teaching that you do there?
Yeah. Well, there's a lot to it. Where do I begin with MBSR training? I personally have taught mindfulness and meditation for many years, and have used it to use this form of it is to teach the practices of it, where people can use it for their anxiety and use it for their depression. And a lot of it has to do with bringing them back into where they go with their ketamine treatment, right? So a lot of it has to do with bringing back that peace, right? So we talk about meditation a little bit differently probably at our center. We use it more in a practical term and practical ways. And there's no other way I can explain it other than that. I make it more of a practice for them to use in their daily life. And with MBSR in general, it's really learning and teaching people about their thoughts, right?
How does a ketamine treatment enhance someone's experience with mindfulness?
Psychedelics in general really kind of make you become present, right? And so it's reinforcing what's really real in this moment and really reinforcing, the past is done. And as much as we want to change that past, we can't. And as much as we get excited about the future and, oh, shoot, we can predict it and have all these thoughts, right, that are going. And, we can make up lots of stories, right? And that's sometimes those future-producing thoughts are really anxiety-producing. And so with meditation and mindfulness practices, it brings us back again into what's really real in this moment. And ketamine has the same exact effects, and that's what we kind of reinforce with that. And it's really been incredible to watch people actually use it and to be able to give them mental tools and mindfulness tools to be able to bring them back into the space of what ketamine really can do. And that's part of the reinforcement. Of course, there's a million other things that I want them to keep practicing to do, including creativity. I teach art as a way for, to use it for the process. I love what they make. I love our art. I love the creativity. But it's about the process once again, and where the mind actually goes during the creative process is what I'm more interested in, because this is a tool that they can always go back to, depending on what. Yeah, it's just incredible. All these different tools to enhance it.
I think we had a question about do people get addicted to it?
Oh, yeah, we do get that. And we also get, besides the addiction, there's also being, is it traumatic, what they're going to see and stuff like that. And so maybe you could address some of that too.
Yeah. So, many people have the question about ketamine. We had the question, is it addictive? Do people get hooked on it, or do they begin to go to other places? And how do you know that they are doing it, and how do you prevent that? Within our process, we do try to keep very strong boundaries around our intention and the purpose, and why people are using it. Our intention is not for people to be on ketamine. That's not our belief that this is the way that it should be a long-term medication. We believe that it's best used as a short-term experience to get insight into yourself, to build some tools, and to use that moving forward. And in that way, you keep that door to dependence closed fairly tightly. As if the intention of the treatment is the ketamine is going to fix me, then that door is open to dependence. We view ketamine as a catalyst for change. And it's the patient's own work that changes them. It's the patient's willingness to look inside themselves and allow the ketamine to do what it's going to do, to allow the dissociative state that the ketamine produces to open that door to transformative change. And it's on the patients to be willing to do that. And the more willing they are to do that work of, I saw this way, and now I see this in an entirely different way from a view of peace or a view of tolerance or forgiveness. And when I look at this thing where before I only saw what I was right about, but now I see where I can have peace. Well, now I have a choice. I have a choice to make between how am I going to see this thing. And that choice is a choice that you can make from that point on for the rest of your life. You don't need continued ketamine to be able to still have that perspective. And that's how we operate in a way that keeps that road to dependence closed as tightly as possible. Yeah. Because it's about enhancing our patient's ability to make that choice and reinforcing within them that they have a choice once they've had that experience. And as far as the question of is there anything scary? Will I be traumatized? We have many patients who come to us with PTSD who have had significant past trauma. that they're coming to try to get past. And we find that the ketamine treatments have a way of supporting them through that. This is why it's important to have guidance and to be in a place where you have that support, because sometimes you do enter a dark place, or there may be a place inside of you that hasn't fully healed yet, and then some light shines on that and things come up. And things come up because they have to be released. Things come up to be released and transformed. And as long as you have a container which we have built around these things, you can be able to go into those tender places with guidance and support and come out in a different place. So while sometimes you do encounter something heavy, that's not to be feared. It actually is very often the catalyst to the deepest change. And that's what we found within our process.
I fully agree. That's good.
So when did you find that, we had another question of, when would I notice a change in myself?
And I think that's a great question, actually. And I think I can answer that because I've seen it with you. And that's, it's interesting. Ketamine changes your perspective, right, on certain things. So it comes out and it kind of expresses itself in subtle ways at first. At least what I've noticed with everyone. And we've done many now. But, I really noticed it when you did your treatments, to be honest. And it was in the subtle changes. It was in the responses. It was in your normal habitual things that people that you live with and your spouses or whatever would notice, right? So, and it was basically him having different reactions to things, maybe. And so what I would see is like, wow, he didn't react the same way that he normally would. Or, well, he's a little more patient with that. Or he's a little more calmer with that. And so that's kind of how I saw it. But people, what we see every day is night and day. I mean, when people wake up from their treatments, they have, it's energy. I mean, there's so many different ways I can talk about it. What we see spiritually, energetically, even behaviorally, people's change. And it's all because of they find it within themselves to make these changes. And that's the beautiful part of it. But on the outside, during the treatment, our patients look like they're sleeping. They have an eye mask on. They look like they're sleeping. But inwardly, they're going on an incredible journey within themselves to find a deeper peace, to find whatever it is that's driving their either anxiety or their past depression or whatever it may be. And they get a different perspective on that. And when you get a different perspective on that, everything changes. Everything changes in all the different areas of your life. So... and I can honestly say it's all different areas of people's lives. So let me see. Then we have how does this compare to other psychedelics? We get that a question a lot because there's a lot of awareness now what psychedelics can do. And
so there's a few psychedelics out there. Ketamine is only one of them. So, there's the classic psychedelics, psilocybin, MDMA, which may very well be FDA approved here next year for psychedelic therapy. There's also ayahuasca, DMT, ibogaine. There are multiple psychedelic compounds. They're all subtly different, and they're all very much the same. The main differences between them are the duration of the experience. Psilocybin, for example, is 4 to 6 hours. LSD, for example, may be as long as 10 hours, whereas a ketamine treatment is 30 minutes to an hour. But the experience of the dissociative state or non-ordinary state of consciousness that psychedelics produce is very much similar. The visual experience can be different. What we call the psychedelic playground has its subtleties, and we call it the psychedelic playground because that's exactly what it is. It's a nice place to visit and it's fun, but it's not a whole lot of depth to it. The depth is someplace else. And we find that all of the psychedelics tend to open that door to that deep work. Some of them longer, some of them shorter, some of them with a more visual input, some of them with a more emotional experience. I find that we find that ketamine has a way of, if someone wanted to transcend something and to be in a peaceful place with something that had happened in the past, that ketamine has a way of just putting them in that peaceful place. And then you have to decide why you can't stay there. And that's what we talk about in integration.
And I have another question too that comes up a lot. I was just thinking about this. We get a lot of questions about IV versus oral versus IM, and maybe we could tell our viewers a little bit about the difference between the three, because there's a lot of difference in the three.
So there's a lot of question, especially with ketamine, on what's called route of administration. And so you can receive ketamine as an IV infusion, you can give it as a shot, you can get it as a nasal spray, you can take it as an oral lozenge. Again, it's similar to the question of the different psychedelics. So different routes of administration have different peak blood levels. Getting it as an injection gives you a higher peak blood level, which gives you a deeper dissociative experience. Our preference is to give it as a shot because that gives people the highest blood level and the deepest dissociative experience, where they have the most transformative change. Other methods of administration, orally, nasal spray, work to a point. We find that the dissociative experience is less intense, and to be honest, we find that these are more applicable in paradigms that are more about maintenance, which is not our approach.
And physical pain too.
Yeah, and for physical pain too. So our approach is more about getting that experience that produces that long-lasting change.
Great.
Thanks for that question.
Yeah, I think I'm trying to. We get a lot of questions, so it's so fun.
I had a question for you.
Okay.
One of my favorite questions is, what do you love about this work?
Oh, where do I start? Honestly, it's. There's a lot to it. I love all of it. I've been saying this a lot, but I think our patients, or I think any patient any person really, that is willing to go within themselves are pretty incredible. They're incredible humans. And so for me, this is completely different work, right? These are working with people that are really wanting to make change. And so all of it. Which part of it? I love all of it. I love working with patients. I love when we get new intakes, and I think one of our patients really, you two smile a lot. And I remember him saying that, and he said, "What do you know that we don't know, that I don't know?" And I kept thinking, yeah, your life is about, and I really recommend to people too to journal all of this and to journal their journeys, because there's so much change that can happen when you really start looking at mindset and mindfulness and using all these incredible tools with the ketamine, because the ketamine opens up different parts of us. For creativity even, it does a lot for that as well. So I get really excited when people want to create with me, and we create obviously in virtual spaces, on Canvas, we create all places, in all realities really. It's kind of my, my jam, but it really is incredible. I love all of it. I love teaching it, and I love the space that we're into. Right. I will tell you that our space is pretty special to me, and there's just that. So I love all of it. And I will say it has been really interesting and fun to work with my husband on something that we had talked about 20 some years ago, of building a place that we could do some deeper healing with people. We had both worked in very sterile environments a lot of years. So this is a whole different kind of work, and we love it. I love it personally.
Great. For myself, I to wrap up, I just love the opportunity to really help people. Yeah. I was an ER doc for 20 years, and as I say, saved a lot of physical lives, or was a participant on the team that saved a lot of physical lives. And this work is just so much more rewarding because we never feel like we're just putting a Band-Aid on things. There's change at depth. People come to our place and they leave changed forever.
Yeah.
And that's the truth. And it's an amazing privilege and honor to be able to observe people come in broken, and over the course of 6 to 8 weeks just rebuild into something incredible. And to see that happen time and time again is pretty incredible.
I do.
And we're grateful every day to have an opportunity to do that work. As we're grateful for the opportunity to have the chance to share our insights and our knowledge of this incredible healing paradigm. We thank you for your time and your attention today, and that's going to be our time today. We look forward to meeting with you again in the future as we discuss our exciting work at the Drake Center and the opportunities for healing, growth, transformation, and to learn everything it takes to become a happy, whole, and well human being. Thank you, and we'll see you next time.